Today, the Wisconsin Department of Health Services confirms the second pediatric flu death in the state.
And officials say we haven't quite hit peak just yet as flu cases continue to rise. Gabriella Becerra is here with more on where this flu season is right now.
Eric and Charlotte, local doctors are seeing record numbers of diagnosed influenza patients this season, and DHS says there are still many weeks of high flu activity ahead. To get through it, doctors are stressing prevention.
Flu is interesting in that it comes in a big wave, and you'll start out with a few cases, and then all of a sudden you'll get a ton, and then it'll peak, and you'll sort of trickle out.
Wisconsin is definitely on its way up. That's how Dr. Trent Thompson describes this flu season.
Sometimes people get the flu and they're not that sick, and then other times, as you alluded to, people are sick and dying. And already this flu season, there have been over 12,000 people in the United States have died of influenza, including the second kid in Wisconsin.
On Thursday, DHS confirmed a second pediatric influenza-related death.
This is a tragedy. Any influenza death is a tragedy, especially a child, and we want to offer our deepest sympathy to the family and relatives of this particular child.
And as cases continue to rise,
this past week, those people who had symptoms of influenza-like illness, over 33%, or 1 in 3, tested positive for the flu.
Health officials are stressing that prevention is key.
We want to emphasize vaccination is still the best means of protection.
And Thompson agrees.
That's the single best thing you can do to prevent the flu.
If you're already showing symptoms, help stop the spread.
If you do have symptoms like that, don't go to school, don't go to work, cover your cough, do all the stuff that our parents told us about when we were kids, and that can help prevent everybody else from getting sick as well.
According to DHS, 40% of the state got a flu shot this season, and that's a record for the state of Wisconsin. They say as long as the vaccine is still available, it's still okay to get.